Today, the syndrome I want to discuss is different from the one we have discussed earlier or before. You know, we discussed the Down syndrome and cradle-child syndrome. But this time around, I want to discuss another syndrome called Klinefelter syndrome. Many of us may not know about it because sometimes it is rare, but the situation that this syndrome has, you can see some people who have it around us, but we will not know. You understand? But this syndrome only affects the male child, not female. Male child, Klinefelter syndrome. All right, it is a situation where there is an excess X chromosome in the XY chromosome of a male child. All right, so let me explain further. Under a normal circumstance, a woman has XX chromosome, while a man has XY chromosome. All right, so that is in their reproductive organ. So during copulation, the female, under a normal circumstance, will always discharge X chromosome because what she has is XX chromosome. She will discharge any of the X chromosome. You understand? So, but the male will discharge either X chromosome or Y chromosome. So, during copulation, if a female discharges a regular X chromosome and a male discharges the X chromosome, then scientifically they are going to produce a female child. But if a female discharges a regular X chromosome and a male discharges his Y chromosome, then we are going to have a male child. All right, that is the scientific proof. All right, but now that is why they say it is the male that determines the gender of a child. If a child is going to be a female, it is determined by the man. If it is going to be a female, if it's going to be a male, it is determined by the man. So any of the gender, it is determined by the man. So majority of us that normally blame the wife for not having a male child, or we are meant to blame the man. No, the man fire very well so that you can have you can produce the Y chromosome. All right, but now in the case of Klinefelter syndrome, the baby is going to have XXY chromosome, which is abnormal. All right, so this XXY chromosome happens when there is an abnormal development, or there is a defect in the development of the baby in the womb of the mother. All right, that is when the situation becomes XXY chromosome, which is called Klinefelter syndrome. That Klinefelter syndrome is the name of I think it's an American. It's the name of the person who discovered it anyway. Klinefelter, I think is an American. So that syndrome only happens to a male child, not to the female. So it is only the male child that has that syndrome. There are other syndromes like XXXY chromosome. We also still have like XXXXY chromosome. But today we are just focusing on the XXY chromosome, the Klinefelter syndrome. All right. So this when a child has this chromosome, the child has a reproductive issue. You understand? The child will not have a normal reproductive organ. So now, how do you know if a child has this syndrome? Pardon me for using baby oftentimes. Maybe because I have a baby at home, and most times that is because of my baby. I come to the car to do my content so that the baby will not disturb me. She disturbs so much. So, pardon me if I'm mentioning baby oftentimes, because you have to notice this situation of Klinefelter syndrome on a child. You understand? The child would have grown to a certain age before you start noticing this. So, what do you notice? What are the physical features that you are going to notice that will let you know that this baby is likely to have this Klinefelter syndrome? One, the baby will have longer legs and a shorter body. Hmm? The child will not have a broader shoulder, just like a normal male guy. The shoulder will somehow shrink. You understand? So then the 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 child we have a small muscle mass. Understand? Like a man, like a guy that should have, you know, this kind of muscle that will always portray him as a man. Then, lastly, of what I know of Klinefelter syndrome, the physical feature, but they are more than that. All right, is that the child we have excess breast tissue. That means the child may likely to develop a bigger breast because of the excess breast tissue. Alright. So the baby is abnormal. These are the features you are going to notice. So once you notice, gradually you start noticing that this child, the legs are much longer than the body. You need to conduct a test so that you can quickly find out if the baby sex organ is normal, if the baby's chromosome is normal. You understand? So once you notice that the child's chromosome is not normal, that the child is suffering from this syndrome called Klinefelter syndrome, then there is need for you to take the child for a treatment. All right. So unlike the other syndrome I talked about, that is the Klinefelter syndrome, that does not have treatment but can be managed. This Klinefelter syndrome has treatment, but this treatment can only be done when at the onset of puberty. At the onset of puberty, that is when the child has gotten to the stage of maturity, when the child wants to become a man. Right? So this is when this therapy will be given. So the child will be given a testosterone therapy. Right? So this testosterone therapy will allow the child to undergo the normal changes that a child that wants to undergo puberty or maturity should undergo. You understand? If this testosterone is not given, then the child will not be able to undergo the normal maturity stage for a man. So to become a man. So that is one. Secondly, there is this excess breast tissue can be removed. It will be removed, and also some other treatment will also be done. You understand? I don't need to discuss all. These are the major ones that needs to be done. So if all these are done, the baby will undergo a normal maturity stage to become a man, to be able to father a child, to be able to reproduce just the way the parents reproduce him. You understand? Then take note that this syndrome is not hereditary. So don't feel that maybe the parents have it, that's why the baby is having it. No, it's it just happened maybe during the developmental stage in the womb. maybe a defect, maybe I don't know which anything could cause it, but it is during the developmental stages in the womb that this abnormal situation happens. So that does not mean that even him that has it, once he has gotten through the treatment, that maybe when he wants to father a child, that there is possibility that the child will have it. No, except if the abnormal development happens in the womb of the mother again. You understand? So it is not hereditary, but I am passing this message to every one of us so that parents can actually notice this. Once they notice such, they should know what to do on time so that it won't be that they may start asking the father that what is happening, why you not having a child when the child gets married, and they now start blaming the wife that you are not giving my child a baby. You understand? So the problem may be from the child because of this Klinefelter syndrome. So always take note. Always make sure you you check your child. Make sure that you look at them very well. Once you see all these features, please take them for a test. So this is just what I want to pass to us. Thank you very much.